Hello and welcome. Thank you very much for joining us this evening as we discuss 2021-2022 school reopening. We will have time to answer questions that have been submitted to the district by Friday, 12 noon. We have answers to those questions, and there will also be an opportunity for you to ask questions in the chat throughout. What I do ask is that you wait until closer to the end to ask your questions, because many of your questions may be answered in the PowerPoint or in the Q&A that follows the PowerPoint presentation. So thank you very much for that. But we will get started now with the PowerPoint for the 2021-2022 school reopening. So please know, although I am presenting, I am also joined this evening with the leadership team, Dr. John McKenna, Mr. Tom Matursky, Dr. Marie Balin, Mr. Anthony Scanzuzo, and Ms. Christine Harding. And as always, our Director of Communications, Mr. Nick Filipowski. I want to thank everyone because everyone has contributed to this document and making sure that it's easily understood by our parents and our community members. So the information that was sent to parents and community members on Tuesday can be found on our district website. The reopening information, which includes instruction, busing, athletics, music, extracurricular activities, is all available on the district's instructional information page, and the health and safety information is on the district's COVID-19 education page. So I'm going to show you what both of those look like. This is the instructional information page, and you're able to click both of those links. And this is the COVID-19 education page. One thing about the COVID-19 education page, we've also linked the documents that helped us to formulate our guiding document. The Erie County Department of Health guidance that was released last week, Monday, the New York State Education Department Health and Safety Guide, the CDC guide, and the American Academy of Pediatrics, the AAP guide. Those are on the COVID-19 education page. Please also know that if you go to your individual school website, these documents are still accessible from the top row, About Us, Department, Schools, at the very end, Instruction in COVID-19 Education. Those links will also be on your individual school websites. Now let's discuss the academic year. So in-person instruction, we know from all the guidance that we've received from the Erie County Department of Health, the CDC, the AAP, Governor Hochul, the New York State Education Department, that the emphasis was on in-person learning. We know that students learn best inside the classroom. We are able to provide social, emotional learning support, and students are able to participate in athletics, music activities, and extracurricular activities, which are important to mental health. So getting students back into the classroom was of utmost importance to us as educators and to our guiding documents, the individuals that put those together. Start of school. All Williamsville Central Schools will be open for full-time in-person instruction beginning on Wednesday, September 8th. Now, students who are enrolled in the E-Academy through BOCES will begin instruction on Monday, September 13th. So from September 7th through the 9th, students who are enrolled in the E-Academy will have a special boot camp. So students who selected the E-Academy will be enrolled for the entire 21-22 academic year also. Busing. And I know we've discussed this previously. We had a survey that was sent out. I discussed it at the August 10th board meeting under community update. And we still have a small driver shortage, still approximately 12 drivers short, but all routes are complete and will be available in WICS this week. So please be patient during the first 2 weeks of school, because we know there will be some lateness in the morning, some tardiness in the afternoon with buses getting the routes completed and down pat. But school buses will be loaded to full capacity and masks are required to be worn, and students will be assigned seats on the buses, and that is to aid in the contact tracing. Now, if students need a new mask on the bus, we will have masks available on the school buses too. Quarantine and instruction. So if a quarantine situation arises, the district will provide digital devices to students to complete instruction, with the exception of the middle school students who receive a Chromebook as part of the district's one-to-one initiative. So if a student, in the unfortunate event that a student will have to be quarantined, the district will provide a Chromebook. However, that device will need to be returned when the quarantine period ends. And to discuss the individual quarantine. So individual quarantine lasts for 10 calendar days. So for school days, that can be anywhere between 6 to 8 school days that students will need to quarantine. The device pickup, the parents will pick up the device from their school building, and the instructional delivery will be asynchronous. If an elementary classroom needs to be quarantined in that unfortunate event, it will be similar. So 10 calendar days, 6 to 8 school days quarantine for students. Device pickup will be the same. Parents will pick up the device from the school building. Instructional delivery, however, will be synchronous and asynchronous. The schedule will be provided by the teacher and the school. In the unfortunate event that there's a full grade level quarantine, it will be very similar to what we just reported on the classroom, the elementary quarantine. So synchronous, asynchronous instruction, and the schedule will be provided by the teacher and the school, and we will arrange to have that device pick up at the district office. So that is the difference. If there is a classroom elementary quarantine, device will be picked up from the building. In the event that there's a full grade level, the device will be picked up from the district office. And the very rare event that we have to actually quarantine an entire school building, or in the event of district closure, those recommendations regarding a school or district closure during the COVID pandemic will be made by the district in consultation with the Erie County Department of Health. Device pickup information will be communicated to parents, and the instructional delivery model will be synchronous and asynchronous, and the schedule will be provided by the teacher and or school. Health and safety, very, very important information. All of this is, but this is especially important. The district works in partnership with the Erie County Department of Health with contact tracing to help identify close contacts who may have been exposed to COVID-19. So if an individual is identified as a close contact to an infected individual, the school building and the Erie County Department of Health will follow up with the parent and guardian or staff member to alert them of their exposure and next steps that must be taken. What is a close contact? Because that definition has changed slightly. So close contacts are defined as students who are within 3 feet now, 3 feet, or teachers and staff who are within 6 feet from a positive COVID-19 case for a cumulative total of 15 minutes or more over a 24-hour period during a time the case was infectious, regardless if masks were worn or not. To that end, seats will be assigned in the classrooms, cafeterias, and all the buses. This will aid us in identifying who is a close contact. Attendance records will be maintained to help with contact tracing in the event of a positive COVID-19 case in our schools. Face coverings. Masks are required to be worn by all individuals regardless of vaccination status in all school district buildings and on the bus. Outside, however, masks are strongly recommended but not required to be worn. Our schools and bus drivers have face masks for students who do not have one, and if a mask becomes soiled, a new mask will be provided. Mask breaks will take place throughout the school day. Each of our school buildings will be allowing 1 5-minute mask break per hour. Individuals must maintain social distancing of at least 6 feet during a mask break. Outdoors also provides an opportunity for a mask break. So this will be taking place. I know a lot of parents had questions about that, but mask breaks will be taking place, 1 5-minute mask break per hour. Vaccination. The district will continue to offer on-site COVID-19 vaccinations and will also continue to partner with the Erie County Department of Health to offer off-site vaccinations for those eligible to help slow the spread of COVID-19. We strongly encourage, if you are eligible, to please make sure you are vaccinated. Physical distancing. The district will be using physical distancing of at least 3 feet to the greatest extent possible in each of our school buildings as we resume full-time in-person instruction. Cafeterias will be used for meals throughout the school day, with students sitting approximately 3 feet apart. At this time, please note, students will also be allowed to face each other during the consumption of meals. For additional details on cafeterias, please contact your building principal. Meals can also be consumed outdoors. Now, prior to contacting your building principal, please make sure you are turning in to your school-specific virtual meeting where each school has operationalized the guidance documents. Elementary meetings will begin on the 31st, tomorrow. Middle school meetings will be on September 1st, and high school meetings will begin on September 2nd. Ventilation. The district is following and complying with CDC guidance as it pertains to proper ventilation within schools during the pandemic. Additionally, while the usage of fans in classrooms in a COVID environment is not recommended, if the classroom temperatures require air movement, many parents have inquired about this because in September it still can get a little hot in our classrooms. Fans will be used by not transferring air across students, but they'll be positioned so air movement is above students and toward the classroom windows. Testing. This refers to the COVID-19 screening testing that we're partnering with the Erie County Department of Health. So the screening testing is recommended for students and staff who are not fully vaccinated at least once per week during moderate, substantial, and high transmission as per CDC guidance. As you know, right now we are in a high transmission area. Testing is established in partnership with the Erie County Department of Health through federal and state funding. The nurses that will be conducting this testing are provided to the district by Buffalo Home Care to perform all of the testing. Testing random consenting sample of at least 10% of students and staff. And we also will have the ability to test proximal contacts to an infected individual. So if you're not a close contact, but you're a proximal contact, we will still have the ability to do that testing also. 2021-2022 EAlerts. So the district uses EAlerts to communicate information regarding schools and the COVID-19 pandemic through text, email, and robocalls. One of the required mitigation strategies in the Erie County Department of Health reopening school guidance is the completion of the daily health screenings and temperature checks before school. So we are required to do that each and every day. The district will send daily text messages reminders around 6 o'clock a.m. So that e-alert you will be getting daily throughout the school year, prompting families to complete the required health screening questionnaire on Wix. So this is a sample of what the text will look like. If you've not already done so, please be sure to sign up for e-alerts on the district website. Please do not stop and opt out of the e-alert service, as you could miss important updates from your school building or the district during the COVID pandemic. If you'd like to opt back into e-alert service, please text START to 60680 and 54968. If you have any questions, please contact the Parent Help Desk at 626-8058. Question and answers. So there was a lot of information that we had for you. Please know that this is being recorded. You can play it again at your leisure, and we will also have the PowerPoint available on our district website. So there were a good number of questions that came through up till Friday at noon. So we're going to start with the questions and answers, and myself and our leadership team colleagues will be answering some of these questions. First question. Does the district have a plan on how to deal with parents and students who will intentionally break the indoor mask mandate? So we really hope that everyone follows the guidance that is given to us by not only now the Erie County Department of Health, but the New York State Department of Health. But it's important to note that all of our schools and buses have masks available to students, staff, and visitors who do not have a face covering. Students are required to follow the district's code of conduct, which is available on the district's website and in the school calendar on page 30. So if a student does present themselves to school or the bus, a mask will be provided for them. Has anyone pointed out that it was very difficult for students to hear teachers while teaching last year with their mask on? It seems to me in order for instruction to be effective, teachers should be allowed, if vaccinated, to remove their mask once the students are seated in the room and the teacher can assume a socially distant position from the students. This will allow for effective communication and instruction to our students. Please note, masks are required to be worn at all times inside school and district buildings, regardless of vaccination status. So I understand that it may be an inconvenience for some. However, we are following the guidance and the masks are to be worn inside the school building and the district buildings at all times. It is an effective mitigation strategy. Our next question and answer will be handled by Dr. Marie Bellin, our Assistant Superintendent for Instruction.
Thank you, Dr. Brownhall, and good evening, everyone. Question is, will teachers be wearing clear face shields so students can see their faces, or regular cloth masks? The answer is face shields are not a substitute for a face covering. Page 3 of the ECDOH guidance document states, quote, bandanas, gaiters, and clear face shields are not considered acceptable face coverings. The next question, will there be additional support for students this year so any who are far behind where they would have been had it been a normal school year? Our goal is to provide an intentionally welcoming environment for all students in the 2021-22 school year. Resources are in place at each one of our buildings during any year to provide supports students may need to have a strong educational foundation.
Thank you, Dr. Bellin. Our next question and answer will be handled by our district nurse practitioner, Ms. Christine Harding.
Thank you, Dr. Brownhall. This question is, and good evening, everyone. This question is, last year, the benchmark for schools to provide remote-only instruction was 100 reported infection cases per 100,000 residents. What is the number of reported infection cases per 100,000 residents benchmark for this school year to provide only remote instruction or a hybrid model, as our 7-day rolling average is well above that number as of today? Is Williamsville Central School District prepared to seamlessly move to remote instruction if mandated by the county or state? Will the format be the same at the 2020-2021 school year, or is there a new technology ready to be implemented if required? Our answer for this question is the focus of all of the guiding health documents that have been received thus far for the 21-22 school year is to really maximize full-time in-person instruction. So at this time, no such benchmarks have been established in any of the New York State, Erie County Department of Health guiding documents for transitioning to a remote or a hybrid model based on the level of community transmission.
Thank you very much, Christine. Next question. Do we have online class? Since kids are not eligible for vaccination and Delta variant is surging very fast based on the news health portal, and especially kids are impacted. So we are scared with current situation for sending kids for in-person class. Now, please know, even with this question, we want to be very clear that the vaccine is available for kids and students ages 12 and older. So if you're speaking specifically of students between the ages of 5 and 11, we know that vaccine has not been prepared yet. But our answer is this. We realize that in-person learning is optimal for student success. To that end, there are no online classes for students unless they need a medical accommodation. They have been able to enroll in the BOCES E-Academy if there is a student that is medically fragile. They are able to enroll in the BOCES E-Academy. Otherwise, we will be open for in-person learning 100% of the time, beginning on Wednesday, September 8th. We're going to return it back to Dr. Marie Bellin for our next question and answer.
Thank you, Dr. Brown Hall. The next question is the district prepared to go virtual once COVID begins circulating? In the rare and unfortunate event where a classroom or school building needs to be shut down, as Dr. Brown Hall mentioned earlier, we are prepared to continue education and learning by moving to a full remote model for that particular classroom or school. The next question is, will there be a regular point of human contact for children in individual quarantine? Buildings will ensure that there's a regular point of contact for students in quarantine. Please know, with the refined definition of close contact, we anticipate a reduction in the number of students that will need to quarantine.
Thank you for that, Dr. Balen. So the next question is a very dense question. What happens if my child has to miss 10 days of school for each quarantine? And let's just go back, because we remember that it'll be 10 calendar days, which may be 6 to 8 school days. What will be done to prevent her from falling behind in her classes, since remote is not an option this year? Let's say that a child quarantines for 10 days, comes back and is exposed again the first day that they are back and has to go out again for another 10 days. Is there a limit to how many interruptions of the learning process there are? If this is the case and the child has many absences, is this what would be done to prevent the child from getting too far behind from their peers? Will tutoring be offered? So we clarified, a quarantine period is 10 calendar days, which may be 6 to 8 school days. Each situation is different and each student will be supported to ensure they remain current. So please note, if a student has to quarantine, there is not a limit to how many times a student must quarantine. But with the reduction of the footage from 6 feet to 3 feet, we anticipate less students requiring to be quarantined throughout the school year. Oh, sorry about that. If a teacher has COVID, will they be without a substitute again this year, like last year, and just watch movies and videos? Our answer, realizing that a substitute teacher shortage is what many school districts are dealing with, our goal is to ensure that every class is covered by a substitute teacher if a teacher unfortunately contracts COVID-19. So our goal, and we know the optimal, to have a substitute teacher in place for any teacher that is out, whether it be due to COVID or a regular absence. So that is our goal, to make sure every class is covered by a substitute teacher. I will take this one, Christine. Will the district release the percentage of teachers who have been vaccinated by building, by school, by district? And our answer, the district has no intent on releasing that information at this time. While we strongly encourage everyone that is eligible for the vaccine to be sure and get it, there is no mandate at this time. And that information we will not be releasing by building, school, or by district. Ms. Harding will take the next question and answer.
Thank you again, Dr. Brown Hall. Will vaccines be mandated in the future? Certain vaccines, as we know, such as measles, mumps, rubella, hepatitis B, polio, chickenpox, are some of the vaccines required for school entrance and attendance. So there is currently no COVID-19 vaccine requirement to attend school, as Dr. Brown Hall had mentioned. However, if the COVID-19 vaccine becomes a required vaccine by New York State Department of Health, it would be required for students to attend school and to continue to attend school like any other required vaccination. The next question, will you have a record of the vaccination status of the kids in school as part of their immunization document? If so, do you plan stricter disease surveillance, such as temperature checks, etc., and mask hand hygiene protocols around the kids not vaccinated? Immunization records can be shared, as always, with your school nurse. At this time, all health and safety COVID-19 protocols are expected to be adhered to by all faculty, staff, and students, regardless of their vaccination status. The screening program that was mentioned earlier is an opportunity where parents can consent to have any of their unvaccinated children, as well as our faculty staff, to be able to participate randomly on a weekly basis.
Thank you very much, Ms. Harding. Our next question or answer will be handled by Mr. Tom Matursky, our Assistant Superintendent of Finance.
Thank you, Dr. Brown Hall. Question is, will the students be allowed to drink water in class? or in between classes, as this would require removing or pulling down the mask? The answer is yes, students may drink water in class or in between classes. Our water fountains have been shut off, but every building has water bottle refilling stations in multiple locations, and they are throughout the school. So just as a reminder, masks are required to be worn when not eating or drinking, or unless you're on a mask break or in the cafeteria.
Thank you very much, Mr. Matursky. Next question. Will parents be allowed in the school building this year? So visitors will be allowed into school buildings, but their movements will be limited to the front foyer or the main office. This may expand as the school year progresses. Visitors are expected to adhere to all health and safety COVID-19 protocols. We do want to limit the movement of adults and visitors in our school building because we know, vaccinated or not, anyone can actually transfer the COVID-19. Can you provide us with guidance for social gatherings such as Fall Fest, book fairs, PTA meetings, etc.? Our answer, virtual meetings should be prioritized over in-person meetings. However, at this time, there is no guidance from the New York State or the Erie County Department of Health on gatherings and events. All COVID-19 health and safety protocols will need to be adhered to for all events and gatherings. Now, we probably will get additional guidance for some of these items, but right now the focus was to make sure we got school started. So as soon as we get guidance and are able to articulate and operationalize what the guidance will look like for other gatherings, we will share that with our schools and our communities also. Can you provide data on the total number of confirmed cases for the 2020-2021 school year, and also include the confirmed number of transmissions that actually occurred within the school? Can you provide the same data for summer school when voluntary masking was in place? Our answer, all case data has been shared daily to New York State Department of Health as well as to the school community. Please visit the school COVID-19 report card, and the URL is right there where you can actually receive that data. Our next question will be handled by Mr. Matursky.
Thank you again, Dr. Brownhall. I remember seeing that there will be free lunch for all students this school year in an email before. Does this mean that students do not need to bring lunch themselves? Then is it okay to bring a snack to school? Yes, this school year, the 2021-22 academic year, free lunches will be provided to all students, including breakfasts. Additional communication will be shared later this week from our child nutrition department on that process. And for specific questions about snack breaks, please contact your building. As a reminder, masks are required to be worn when not eating or drinking. One additional item of note, we do ask that parents would who comply and would respond to the ability to put in a free and reduced lunch application do so. Those are due in October, as would be normal.
Thank you, Mr. Matursky. Our next question and answer will be handled by Dr. Balin.
Thank you, Dr. Brownhall. The next question is there any guidance or restrictions on sharing of classroom materials such as books, math manipulatives, game pieces, science materials, etc.? The answer is the sharing of materials should be limited to the extent practical unless the core activity involves the sharing of materials. If materials are shared, they should be cleaned before their next use. Additionally, individuals need to wash their hands or use hand sanitizer before and after sharing materials.
Thank you, Dr. Balin. Our next question. Will there be a drive-through style drop-off and pickup available to reduce the amount of adults outside congregating during the morning and afternoon? Our answer. At the elementary, middle, and high school level, parent pickup and drop-off plans have been established. For specific questions regarding your school, please contact the building directly, and this will probably be addressed at one of the upcoming virtual meetings each building is holding this week. Now, with that formal presentation over and answering of questions, we will jump over to see if there are any questions in the chat that we are able to answer for you at this time. Again, while we're accessing those chat questions, I thank you all for virtually attending this evening to receive this information and to understand the answers to the questions that you have submitted. So we will answer a few more questions throughout the chat.
Can I just read it to you?
Yes, please.
Question, if the child is 3 feet away with a mask, is that within 3 feet, so they need to quarantine if exposed or no? In other words, is that 3 feet with a mask? Do they quarantine if exposed to an individual who has COVID?
So if they are within 3 feet with or without a mask, yes, they would need to quarantine. But we want to make sure we understand that if they're within 6 feet of an adult, then they would need to quarantine. So the 3-foot rule is student to student. Once you put an adult into the mix, that becomes the 6 feet. Correct?
Yes, the only thing I would add is that we are obviously preparing and planning and implementing 3 feet of distancing. That is our minimum requirement for students, and the 6 feet for adults is the minimum requirement. So if we're meeting those minimum requirements and falling within the 3 and 6 feet, then you would not be subjected to a quarantine.
Thank you very much, Ms. Harding. I appreciate that.
Another question, Dr. Brown Hall. Are there any plans to have kids eat in their classroom rather than the cafeteria due to distancing requirements?
And that is a school by school question. So you want to definitely ask your school at building administration when they have their virtual meetings, because that is a school by school question. I know some schools will be still having some classes eat in their classrooms, but again, that's school by school.
If a student or staff member gets sick, and they still have symptoms after 10 days of quarantine, will they return immediately after their symptoms are gone, or will they be required to stay home an extra few days after symptoms disappear, and then they can return to school?
Christine, do you mind taking that?
Yes, sure. So there is specific return criteria for any individual, whether it's a student, staff member, faculty member, in order to safely return back to work or school. So the criteria is, and the question, part of the question meets some of the criteria. They do not have to be symptom-free to actually return to school or work. They have to show a progressive improvement of their symptoms in order to come out of isolation. Obviously, if they were still experiencing significant symptoms, not well enough to perform their work duties or attend and receive their instruction as a student, they may need to take additional time beyond the 10 days. But the actual isolation period would be that 10-day period from the time the symptoms started. The other return criteria obviously would be, we would need to know that they've actually adhered to, complied with the full isolation order, because sometimes, depending on the situation, there may be differences in terms of when a person can return or not.
Thank you very much for that. Nick, are people at home able to hear you?
Yes.
Okay, awesome. Thank you.
Next question. Will students be required to wear masks during physical education classes?
And that answer is yes. They will be required to wear masks during physical education classes.
Will lockers be available to be used?
Christine or Marie?
Yes, I believe we landed. And back to the phys ed piece, I just want to indicate
Please.
the difference between indoor and outdoor activities as well. So indoors, we know it's a requirement for everybody to adhere to the masking, but outdoors, it is a strong recommendation and not a requirement. So I just want to add that piece in there. But in terms of lockers, we would, obviously limit the amount of time that students are spending out in the hallways, but having access to their lockers would be something that would be appropriate at this time.
Thank you. And thank you very much for that clarification of indoor versus outdoor physical education.
Sure.
I appreciate that.
Dr. Brown Hall, I would just add with the locker component to please, if any of our parents have specific questions for their schools, to please pose that question to their building administration so that they may address the duration of the use and the purpose of the use. so that it's clear when they're being used and how in that particular building.
Awesome. Thank you very much. Great point.
The next question, Dr. Brown Hall, would the children in the e-learning academy be able to switch to their regular in-person classroom once they become fully vaccinated when vaccines for kids younger than 12 become available at the end of 2021?
So we battled around this for a while, but the E-Academy through BOCES is a full year commitment. So that is something that we stressed to parents prior to them signing up, but the E-Academy through BOCES is a full year commitment. Thank you for that question.
What are the consequences if a student repeatedly refuses to wear a mask while in class?
Right. So what we don't want to do is, criminalize students who refuse to wear a mask. So we will use progressive discipline, but we want to have a conversation with the student and the parents and go over the code of conduct and the requirement for wearing a mask. The mask is a mandate from the Erie County Department of Health and the governor's office through Commissioner Zucker. So we really, really need everyone to comply with the mask wearing.
This question, why isn't virtual learning being offered this year for students who have to quarantine?
Well, again, so virtual learning is only going to be offered, remote learning, if we have to shut down an entire classroom or in the unfortunate situation where we have to shut down an entire school building. We know that it's optimal to have students in the classroom, and we know what difficulties we experienced last year with either hybrid learning, concurrent instruction, where the teacher was attempting to teach both at the same time. But we want to assure any student that has to be quarantined, whether it be 6 school days or 8 school days, will receive asynchronous learning and a contact so that we are sure to have them kept on pace. When they return to the school building, we'll do all we can to make sure that if there's any unfinished learning, that student is caught up appropriately.
Will children in the lunchroom sit adjacent to the same children they sit near in the classroom? If kids are 3 feet apart while eating unmasked, wouldn't they qualify as a close contact if an adjacent child is COVID positive, even if sitting next to that same masked child in the classroom did not constitute a close contact?
Can you just please repeat that question? There's a lot of commas in there.
There's a lot in there.
Right.
Will children in the lunchroom sit adjacent to the same children they sit near in the classroom? Assuming they're talking about having assigned seats in the classroom, same assigned seats in the cafeteria.
Okay.
If kids are 3 feet apart while eating unmasked, wouldn't they qualify as a close contact if an adjacent child is COVID positive, even if sitting next to that same masked child in the classroom did not constitute a close contact?
Christine, can you take that?
Sure. So basically, right now, we assist Erie County Department of Health with their contact tracing protocol. So at this time, all we know is that anyone within 3 feet, and we will have those assigned seats, attendance records, would be identified as a close contact, regardless really of masking or not. So obviously, the cafeteria is a more crowded setting. You have students on masking for a greater period of time. So at this point, it's a big question mark actually for us too, in terms of what Erie County Department of Health will do, given the nature of the cafeteria in and of itself being more crowded and the amount of time people are spending on masks. But the definition we have to operate under right now is anyone within 3 feet, if we're talking about students, would meet that definition of a close contact, regardless of the mask on or off.
Thank you very much. Next
What are
question.
the- oh, sorry.
No, I said next question. I'm sorry. Thank you.
What are the logistics of students eating meals outdoors?
So again, that will be a school by school situation. So please, I encourage you to ask your building principal about that. So I'm sure it'll be school by school and classroom by classroom.
Is it still the case that vaccinated individuals won't be asked to quarantine? Can vaccinated individuals still catch and spread COVID-19?
Great question. We have a great answer, don't we, Christine?
We do. So at this point in time, fully vaccinated individuals, whether we're talking about students, faculty, staff members, and fully vaccinated means a full 2 weeks has to elapse from their final dose of their vaccination series. Those individuals, we still have to identify them as close contacts to the Erie County Department of Health, but they are not subjected to a quarantine. The only time that would occur would be if they themselves start to develop symptoms, then they'd have to stay home and isolate.
Thank you for that. It's another encouragement to be vaccinated. Next question, Mr. Filipowski.
Will students be changing for gym class?
Yes, it is my understanding that students will be changing for gym class. Again, every school will operationalize what that looks like, but yes, that is the case.
What strategies has the district implemented to ensure improved ventilation per the U.S. Department of Education guidelines to prevent COVID-19 spread? Specifically, will there be air purification systems, CO2 monitoring, full indoor air flushes at the beginning and end of each school day, disabled demand control ventilation control? Has a ventilation report been completed for each student's space?
Well, I am going to ask Mr. Matursky to take that question, even though some of the items that were mentioned in that question are not CDC recommendations. I will ask Mr. Matursky to take that question, please.
Thank you, Dr. Brownhall. Over the summer, we have done all of the required filter changes, and we have verified that all of our systems are operating at the maximum capacity per their design specifications, which meets the CDC requirements. In regard to some of those other items that you mentioned, air purifiers and items like that, in reality, we were on a conference call with New York State Department of Health. That was about a week and a half ago, and they had an engineer on, and that question was specifically asked to them. And essentially, because those systems are individualized and they're small, they actually do not provide significant benefits to a classroom's air quality. The recommendation per CDC and what we are following is to make sure that we have maintained our systems to the efficiency like I mentioned. Additionally, we are running our systems much more as far as hours before and hours after school to make sure that we are continuing to flush out the air on an ongoing basis. And in all of the pertinent ability to have windows open, we will be doing that in classrooms too.
Thank you very much, Mr. Matursky. I appreciate that. And I also want to thank Mr. Filipowski for reading these questions, going through them just to make sure that we're not answering any duplicative questions or that ones that are redundant, so we can get to the unique questions that parents may have. So thank you for that, Mr. Filipowski.
Next question, September 8th, when school starts, are parents allowed to help students with carrying their supplies? Is there a process for this?
So again, and we appreciate these questions, we truly do, but we want to make sure that you are tuning into your school's virtual opening day and operationalization of those and asking your school what that looks like. So if you could please do that, we greatly appreciate it, because it will be individualized for each school on how they operationalize the guidance.
The next question, what is the district's plan for students who can't tolerate a mask due to sensory needs or related to a specific disability?
So either Mr. Scanzuzo or Christine, if one of you can handle that question, please.
Sure. Yeah. So we obviously the requirement, the mandate is for face coverings to be worn by all individuals, but we know there are students who have disabilities. We have students who have medical conditions that do not allow for masking all day long. So we would ask, if we don't already have that information on file as it pertains to that specific child, we will work with the parent to obtain that information. And then as a school team, we're going to work together to assist the family, assist the student with building any degree of mass tolerance, working with you in terms of what practices do work, so other mitigating practices. So it may be a different type of a face covering that allows for students with sensory issues to be able to tolerate better. We'll do other mitigating practices like 6 feet of distancing. We'll do possibly a physical barrier. And then we're going to really work with that student to maybe they can't tolerate for more than 5 minutes of face covering. We will help to build that mass tolerance through different reward systems, incentives, stuff like that. So it's really working together in partnership to help adjust that student as best as possible, keep our students as safe as possible, and really working together to get that achieved and done. We are not going to exclude, nor can we, any student from attending their in-person program due to any kind of disability or medical condition.
Thank you very much, Ms. Harding.
In the event that an elementary class, grade, or school needs to quarantine, how much synchronous learning can we expect? The remote model last year involved about 3 hours a day of synchronous instruction.
Dr. Bellin, can you take that question, please?
I can. Thank you so much. We are certainly looking at that very closely. We have examined all of the schedules that we had in place last year. We are actually getting ready to finalize the timeframes involved with regard to synchronous learning, and we will share that per building. Please remember that there are unique schedules that, as we alluded to earlier, teachers and schools will also share. So what we share as a district are the general parameters. They're not the specific schedule. So please expect to see those from the individual teacher, class, or building as it pertains to those specifics.
Thank you very much, Dr. Bellin.
This is in relation to the survey we did a couple weeks ago.
Okay.
Will the district share the aggregate results of the informational survey from a few weeks ago?
Sure, we can definitely share that, but we want to make sure that when we share it, we put it in context also. So we will share that, but we will provide some context also.
Other set of questions that we received.
Absolutely, we appreciate it.
Will intramurals be offered at middle schools?
Dr. Bellin, can you take that?
Yes, thank you, Dr. Brownhall. Intramurals will be offered at our middle level. Again, one of the key components there is that we will be communicating and ensuring that our health and safety protocols are followed. We recently met with Ms. Harding, our athletic director, Chris Muchika, and our assistant superintendent for HR, Dr. McKenna, and we are ensuring that we are ready to move forward. And we look forward to this being a part of our program again this year. So again, if any parents have any questions after the information is conveyed, to please reach out to the buildings, specifically your middle school, as they will have more specific information to share.
Thank you very much, Dr. Bellin. And again, we want to appreciate everyone for tuning in this evening. I think we have just a couple more questions to get through. Again, this video recording will be available as well as the PowerPoint, but I also want to encourage you to please tune into your school building's virtual session to address any school-specific questions you may have. Again, elementary schools will be hosting theirs on tomorrow evening, August 31st. Middle schools will host theirs on Wednesday evening, September 1st, and high schools will host theirs on Thursday evening, September 2nd.
Dr. Brownhall, may I also add,
Please.
I think the question may have, if I recall correctly, on the intramurals mentioned middle schools. We also do run a K-4 program, so there will be also information forthcoming on that as well.
Awesome. Thank you very much for that, Dr. Bellin.
What are the cleaning and sanitizing procedures of the school throughout the day?
I'll ask Mr. Matursky to please take that question.
Thank you, Dr. Brownhall. Our district will, again, we're following all the CDC protocols on cleaning. The cleaning protocol throughout the day will involve wiping down cafeteria tables after lunch and general cleaning. At the end of the day, we will be cleaning all of the classrooms. If there is a COVID positive case, that will also involve the necessary CDC requirements, including disinfecting that space and then cleaning it.
Thank you, Mr. Matursky. And then just to piggyback on that question, I do believe that the buses will also be cleaned right down between the morning run and the afternoon run too. So I know that was a question that a parent that brought up to me. So thank you very much for that, Mr. Matursky. Next question, Mr. Filipowski. We probably have time for a few more.
How is the district planning to support children who are experiencing anxiety as they return to school during the pandemic?
So that's a great question. And a lot of that depends on the social emotional learning we have in place. So I asked Mr. Scanzuzzo just to maybe talk a little bit about that.
Sure. Thank you, Dr. Brown Hall. Each of our buildings are going to be experiencing some check-ins with our staff and our students to basically develop the relationship piece, but also to establish any anxiety related issues that may be forthcoming. So all of our teachers will be, tier 1 interventionists to be able to determine the level of interaction that they may need with the student who's experiencing anxiety type behavior. And if it's beyond what the teacher can provide, there are supports in the school to work with our school social workers, school psychologists as well. In addition to the more severe cases, we're working with, we have a contract to work with a licensed practitioner, Kimberly Morrow, who's been more of a consultant to work with our staff with some of our most severe cases of anxiety and helping them determine what would be best suited for the child to better mitigate any anxiety levels on their behalf so they can manage to get through their school day, work through the anxiety piece, develop strategies to cope with their with what they're feeling on a daily basis.
Awesome. Thank you very much, Mr. Scanzuzzo. I appreciate that.
Next question, under what circumstances will qualify for a classroom shutdown, a full grade shutdown, or a full school building shutdown?
And so what we're going to do is still review that, because what I don't want to do right now is say these are the guidelines of what we'll be looking for, or the trigger points, right, to shut down a classroom or to shut down a school building. So what we're not going to do is identify and define that right now. We will still be in consultation with the Erie County Department of Health, and we'll look at best practice around that, just so that we are able to slow any spread that may be occurring in our school buildings.
Another question relates to assigned seating in the classroom and the cafeteria.
Mhm.
Is there an effort to match seating charts in class to seating charts in the cafeteria in order to reduce the total number of potential close contacts?
Yes, so that is similar to a question that was asked previously. So what we're going to do is try to incorporate all of those best practices, right? Knowing that if students, so if myself and Dr. Balin, Mr. Scanzuzzo and Christine sit like this in the classroom, it would make sense to keep us in similar seating in the cafeteria, so that when contact tracing needs to occur, we know exactly who that student has been in close contact with. So thank you for that recommendation. Mr. Scanzuzzo?
Yeah, I'll also expand it. At the elementary level, it'll be much more manageable to cohort students, just as you explained. It gets a little more difficult in the middle and high school as students are changing from class to class, but every effort to cohort students so that they are, together, contained together, is something that we're looking at doing.
Thank you, Mr. Scanzuzzo. That's the word I couldn't think of, cohorting. Thank you very much for that. Next question, Mr. Filipowski.
Similar to what Ms. Harding answered earlier, will a negative COVID test be required to return after quarantine?
So I'll go through the entire return protocol just so people can understand that. So for quarantine specifically, so if someone is under quarantine, it is not a requirement to get tested. It's just a strong recommendation to get tested, and a negative test result doesn't get you out of a 10-day quarantine any sooner. So it just gives you an idea of your status after you've been exposed, after being identified as a close contact. So it does not get you out of quarantine sooner, and it is not a requirement to get tested. Just to review the return to school protocol for any student or staff member. So if someone is answering yes to a COVID question on our screening questionnaire, so that's that question number 1, regardless of your vaccination status, and this is a really important point because vaccinated individuals can still, in fact, test positive for COVID, and the only way to know, unfortunately, is to get tested. So if you're answering yes to question 1, that you have any signs or symptoms your child does of COVID-19, then you are to stay home. Your options are to get tested and produce that negative test result. You can also go to your doctor and provide an alternative diagnosis if they're able to determine that there's another cause, another medical reason for your symptoms, and they attest to that in writing and submit that to us. That's another opportunity to return to school. And then the third opportunity would be if 10 days has elapsed since the first symptom, then that is in lieu of getting tested, then that is your opportunity to return after waiting those 10 days.
Thank you for that very thorough answer, Ms. Harding. We greatly appreciate it. So I want to encourage everyone again to please visit our website and really look over the instructional document, the health and safety document, because we have all the particulars in there. And we also have the links to the Erie County Department of Health guidance, AAP, CDC guidance, the New York State Education Department guidance, also linked to our website. And that's where you will find the particulars. And last, but certainly not least, please plan on attending your school's virtual information session that will be held this week. Again, elementary tomorrow night, middle school September 1st, and high school September 2nd. One last question, Nick, we have time for, and then we will encourage everyone to have a great evening.
Yep, last question. I believe this is already answered, but it's come up several times in the chat. When a child is waiting the 10 days, I'm assuming a quarantine, are they able to join class via Zoom?
That will be a no, because when students are quarantined, they will have asynchronous instruction. We will not have the high flex model working or the concurrent instruction working. So students will have asynchronous instruction. They will have contact, so they are kept abreast and kept on track. And then when they return to the school building, as always, our phenomenal teachers in the district will make sure that student is able to catch up with any unfinished learning that they did not accomplish while they were home learning asynchronously. So thank you very much for that final question. And parents, community members, thank you very much for joining us this evening. We truly appreciate it, and we hope we answered as many of your questions as possible. But again, please refer to the guidance we have on our district website, and be sure to ask your school-specific questions to your school administration. Our administrators are eager to hold these meetings, operationalize the guidance for their school building, and welcome all of your students back on Wednesday, September 8th. So again, thank you very much, and we look forward to welcoming all your students back to a healthy and safe environment. Have a